Do you constantly ask people to repeat themselves? Is your TV volume on full blast? If you answer yes to these questions, you probably need a hearing test to determine if you are suffering from hearing loss. Joining me with answers to questions and a look at current trends for treating hearing loss is Dr. Darryl Willett from Hearing Health Solutions and Ohio ENT. Dr. Willett, nice to have you here.
Thank you, Gail, for having us.
This is something that a lot of people develop as they age, and I think the number of those affected by hearing loss, people would be astounded at that number, Doctor.
Gail, it's amazing. You know, our population is getting older, we're healthier, and so we're finding more and more people as time goes on with hearing loss. About 30 million Americans suffer from hearing loss.
Huge numbers.
It's incredible. If you really look at chronic disorders, it's third behind heart disease and hypertension. So it affects many, many people. And it's not just adults. Children also. About 1.5 million children have hearing loss.
You know, that was going to be my next question, is we always assume that hearing loss is associated with aging. Not necessarily.
No, not necessarily. In fact, it's very common for children in the office to have a little hearing loss from diseases such as ear infections or fluid in their ears.
Really?
Absolutely.
What about then all the other ways that we can develop hearing loss? Loud concerts. Everybody's got stuff in their ears now. I mean,
absolutely.
From their iPods and their iPads and...
Yeah, the etiology of hearing loss is just so broad. We have anything from hereditary hearing losses, aging hearing loss, medical conditions that create hearing loss, and infections. So, yes, the spectrum is huge.
So what can we do about it? What can Hearing Health Solutions do to help people?
Well, we have available for patients an opportunity to come and have an early screening of their hearing loss. And in the process of trying to figure out what their source of hearing loss is, we can offer them, hopefully, medical treatment, maybe surgical treatment, but as a last result or a final result, hearing aids.
And that's not something to be ashamed about or to fight?
Absolutely not. Absolutely not. You know, in this day and age with digital technology, these hearing aids have gotten very small. And if you had a little embarrassment about hearing aids, we got just the right one for you.
We're taking a look at some of them. In fact, they're so small it's even hard to show up on camera. So I can imagine they're hard to see in people's ears. Absolutely.
And we've got a variety for all different types of hearing loss.
Give me examples of what you mean, different types of hearing loss.
Well, for instance, the smallest one that we have is an in the ear canal. Completely occludes the ear canal, and that's for more of a mild type hearing loss. And then you advance to the one that's behind the ear, which has gotten so much smaller over the years and much lighter and more comfortable for the patients. And that's kind of the Cadillac of the hearing aids for the more severe, profound hearing losses.
You also brought something that helps people to hear better with their iPods and to hear better with the television and all those things.
Again, I mentioned the digital technology. We now have hearing aids that have Bluetooth technology.
I mean, I laugh, but it's wonderful, but you don't even think about that.
Who would think? Yeah, there's probably high school students coming up with this kind of stuff. But it's Bluetooth technology that you can actually utilize your cell phone without putting it to your ear, or you can watch TV through the Bluetooth.
So that the whole room doesn't have to be listening to a TV on full blast volume.
Big complaints from the spouse, absolutely. So.
You are in a partnership with Ohio ENT and Hearing Health Solutions. How does that partnership work? How does it benefit patients?
Well, first of all, we have actually been in the hearing aid business with that relationship for about 30 years now. And in order for a patient to go through the process of obtaining a hearing aid, they have to be medically cleared first. You have to make sure that it's not a disorder that you can treat. And so they have to see and be signed off by a physician. So what we've done is made it available and tried to streamline this process whereby the patient has the access to the physician right away and the hearing test right away, and they can go ahead and experiment and take a look at what's available in the styles of hearing aids that are out there for the patients. So it's one-stop shop.
Well, I was going to say, that really helps for the patient. There's no going back and forth. The physicians that don't know what the other, it's what's one hand doing, the other hand doing.
Right, and there's times when there needs to be some troubleshooting. Patients have a little bit more difficult, or maybe the patient has some wax impaction, and the audiologist can't get that out. So we're right there in the office to take care of those issues.
And that's interesting because people think hearing loss and they right away think hearing aids, and it could be many other things that are causing the issues.
That's right. That's right.
Well, it's been very interesting to talk with you today, Doctor. Thank you for filling us in.
Appreciate it.
Love the Bluetooth stuff.
Yeah. What's next?
What's next? Thanks much.
Thank you.